Hello, my name is William Tillett. I'm a consultant rheumatologist, and in this short video I'm going to be talking about non-drug treatments in arthritis. This means the things that people can do alongside their medication: exercise, diet, stopping smoking, supplements, and some complementary therapies. I should say, at the very start, I'm a doctor who specialises in medicines, not an expert in holistic therapies, but I also recognise that medicines are not cures for everyone, and many people quite reasonably want to know what else they can do to manage their arthritis. So, the aim of this video is to help you understand what has the best evidence, what might be worth trying, and what to be cautious about. When a rheumatologist sees somebody with arthritis, one of the first questions we ask is, where are the symptoms coming from? Are the symptoms due to active inflammation? For example, a swollen joint or active tendon inflammation? Or are they due to non-inflammatory causes? For example, mechanical pains, osteoarthritis, tendon strain, muscle weakness, fatigue, poor sleep, or even the after effects of previous inflammation. That distinction matters because it helps us choose the right approach. If inflammation is active, medication may be needed to control the disease and prevent damage. This is important. For inflammatory arthritis, drugs can be transformational. They can reduce inflammation, improve symptoms, and crucially, help prevent damage. No lifestyle intervention has been shown to do that on its own. But that does not mean that lifestyle and non-drug treatments are unimportant. They can make a very real difference to pain, fatigue, function, general health, and quality of life. The non-drug treatments with the strongest and most consistent evidence is exercise. Exercise is recommended for people with inflammatory arthritis and related conditions. The benefits include improved pain, fatigue, better muscle strength, improved cardiovascular health, and better quality of life. A useful way to think about exercise is not as one thing, but four things. First, cardiorespiratory fitness. Activities like walking, cycling, swimming, or using a cross trainer. Second, muscle strength, resistance exercises, weights, bands, or body weight exercises. Third, flexibility, stretching and maintaining range of movement. And lastly, fourth, balance and coordination, sometimes called neuromotor performance. The best exercise is usually the one you can do regularly and safely. For many people, that might simply start with walking. For others, it may involve supervised physiotherapy, hydrotherapy, gym-based exercise, or a structured program. The key message is, movement is treatment. It may need to be adapted during flares, but stopping completely is rarely helpful. Diet is another key area people ask a lot about. There is interest in the Mediterranean, ketogenic, or even low-calorie diets. Of these, the Mediterranean-style diet is often easiest to recommend as a general healthy pattern. It's rich in fruit, vegetables, cereals, olive oil, nuts, legumes, and fish. And in lower order, red meat and processed foods. Weight loss can also be important, particularly for people with psoriatic arthritis who are living with obesity. Studies suggest that weight loss can improve disease activity, pain, function, skin psoriasis, and response to treatment. But very low-calorie diets are difficult and should be done with the proper support. So rather than thinking, what is the perfect arthritis diet, I would suggest asking, what healthy eating pattern can I sustain that also helps my weight, energy, and cardiovascular risk? The next important area is smoking. Smoking is bad for arthritis, it's bad for treatment response, and it's bad for cardiovascular health. If you smoke, stopping is one of the most powerful non-drug treatments you can make. It's not easy, and often people need support, but it's worth pursuing. What about supplements? Omega-3 oils may have some benefit for chronic pain and inflammation, although the effects are usually modest and take time. Turmeric, curcumin, has some evidence in rheumatoid arthritis for improving pain, reducing the number of tender joints, and it's generally safe for many people. But supplements can vary in quality and they can interact with medication, so you should not replace your prescribed treatment. Glucosamine and chondroitin are commonly used, especially in osteoarthritis, but the evidence is mixed. Some people feel they help, but larger reviews suggest benefits may be small and not meaningful. They can also cause side effects such as indigestion, diarrhea, headache, drowsiness, and allergic reactions, particularly in people who have a shellfish allergy. Chondroitin may also interact with blood thinners such as warfarin. So my advice is, if you try a supplement, try one thing at a time, give it a defined period, and stop it if there's no clear benefit or if you develop side effects. Some complementary therapies may also help symptoms. Acupuncture may help people with pain. It involves stimulating specific points in the body, sometimes with needles and sometimes with electrical stimulation. Aromatherapy, massage and reflexology have also been studied particularly for fatigue and may help with relaxation, pain and tiredness in some people. These approaches are not cures for inflammatory arthritis, but they may be useful as part of a broader self-management plan, especially where pain, sleep, stress or fatigue are major issues. The evidence for probiotics is mixed. There is some interesting evidence in psoriasis, but studies in spondyloarthritis have not shown clear benefit. They may also cause bloating, diarrhea or constipation. At present, we do not yet know which probiotics, if any, are useful for arthritis. Finally, it's important to talk about what to avoid. I would be cautious about cannabis and CBD products for chronic arthritis pain. Despite widespread promotion, NICE guidance does not recommend cannabis-based products for chronic pain. Cannabis can also carry risks, including effects on mental health and cardiovascular risk, particularly with frequent or high potency products. So, to summarise. First, understand whether your symptoms are inflammatory or non-inflammatory. Second, remember that medication has a key role in controlling arthritis and preventing damage. Third, the best non-drug treatment is exercise, including fitness, strength, flexibility and balance. Fourth, diet, weight loss and stopping smoking can have really important benefits, especially for long-term health. Fifth, some supplements and complementary therapies may help symptoms, but the benefits are usually modest and should be used safely. And finally, be careful with treatments that make big claims but have limited evidence, especially cannabis products for chronic pain. The best approach is usually not either medicines or lifestyle, it's both. The right medication plus the right self-management plan tailored to you. Thank you for watching.